The maxillary lateral incisors are a pair of upper, maxillary, teeth that are located laterally, away from the midline of the face, from both maxillary central incisors of the mouth and medially, toward the midline of the face, from both maxillary canines. As with all incisors, their function is for shearing or cutting food during mastication, commonly known as chewing. There are generally no cusps on the teeth, but the rare condition known as talon cusps are most prevalent on the maxillary lateral incisors. The surface area of the tooth used in eating is called an incisal ridge or incisal edge. Though relatively the same, there are some minor differences between the deciduous, baby, maxillary lateral incisor and that of the permanent maxillary lateral incisor. The maxillary lateral incisors occlude in opposition to the mandibular lateral incisors. In the universal system of notation, the deciduous maxillary lateral incisors are designated by a letter written in uppercase. The right deciduous maxillary lateral incisor is known as D, and the left one is known as G. The international notation has a different system of notation. Thus, the right deciduous maxillary lateral incisor known as 52, and the left one is known as 62. In the universal system of notation, the permanent maxillary lateral incisors are designated by a number. The right permanent maxillary lateral incisor is known as 7, and the left one is known as 10. In the Palmer notation, a number is used in conjunction with a symbol designating in which quadrant the tooth is found. For this tooth, the left and right lateral incisors would have the same number, 2, but the right one would have the symbol underneath it, while the left one would have. The FDI notation has a different numbering system than the previous two, and the right permanent maxillary lateral incisor is known as 12, and the left one is known as 22.
Please subscribe and thanks for watching.